Good day.
Well, today is World Mental Health Day. This is a day to raise awareness about mental health issues. And according to a new survey, get this, more work needs to be done. 90% of Americans believe the country is facing a mental health crisis, and most at risk, those between the ages of 18 and 29.
Crisis Text Line is a nonprofit organization that provides free 24/7 text-based mental health support. This week, it is hosting a series of events with discussions about youth mental health. Joining us this morning, Dr. Shairi Turner, Chief Health Officer at Crisis Text Line. Thank you so much, Dr. Turner, for being with us.
Good morning, Rosanna and Bianca. Thank you for having me here on this very important day,
Yes.
World Mental Health Day.
Can we talk about it a little bit? Because why does it seem like we are seeing more and more people suffering with mental health these days?
So these are difficult times, as you can imagine, with the pandemic, with just the economics, the politics, everything that people are facing, especially our youth, is causing pain, is causing stress, is causing anxiety. And what's good about it is that we're talking about it. We have days like World Mental Health Day. We have months like Suicide Prevention Awareness Month, so that people are starting to become more comfortable talking about mental illness and mental health and well-being.
So what can be done? Because it just seems like such a big problem, and you know, there are not enough beds to deal with the mental health of people in our city.
And not everyone needs to be hospitalized. I think that's one of the important things to think about. Crisis Text Line provides text-based support as a preventative measure. So anyone can text in to Crisis Text Line by texting 741-741 in English or in Spanish and get the support that they need. So it doesn't have to be suicide. It can be anything from homework to relationships to anxiety to loneliness. So Crisis Text Line is a resource. We're a resource for each other, just being with each other and acknowledging the stress and the strain that exists for us, and standing by someone and trying to help or providing resources is always an option.
Now, you mentioned that these are preventative measures before you reach a crisis. I think there probably also has to be some destigmatize of getting therapy. Would you guys propose that, and how can we do that on a wider level to make sure that people think that that's normal and that's okay, that they can get therapy before they get to a crisis?
Right. It's so important to deal with the stigma, and every community has a slightly different type of stigma around mental health, whether it's, you know, I'm strong, I don't need it, or I should use prayer. But the point is, mental health professionals are professionals, and they are there and available to help people before they get to the point of suicide or a true crisis. So prevention is the key, and the more we talk about it, it's been incredible to see some of our elite athletes starting to discuss mental health and taking time off for their mental health and well-being. That's how we normalize the conversation. That's how we help people talk about their own mental health and well-being, especially when they're not doing well.
Yeah, absolutely. When you talk about normalizing things, you've seen a lot of companies implement a mental health day, paid day off for their employees. How can we normalize that moving forward? Do you think that's going to be possible? Do you think everyone will get on board with this?
I would love that. I think as we start to integrate and embed discussions about mental health, discussions about well-being, allowing people to take days off when the stress is just too much, they will return more productive if they've had the time to deal with whatever stress, anxiety, or loneliness they may be dealing with on a given day, and providing insurance so that people can get not just physical health care, but mental health care as well. So ensuring that employers have the mental health coverage for their employees. It only benefits us as a society. It only benefits our workforce.
Dr. Turner, where can people find you again?
They can text 741-741, text help, text ayuda. We are available on WhatsApp, but please just program it into your phone so that you have 741-741, and you will be met by a crisis counselor who will help you with whatever crisis you may have.
Dr. Turner, thank you so much for chatting with us about this important day. We appreciate that.
Thank you.
Okay, let's talk a little weather right now. Mike Wood.